Hi, everyone. It's Joe Veneri, the host of Fit Insider, the show where I talk with the entrepreneurs, executives, and investors who are redefining the business of fitness and wellness. Today, I'm joined by Jonathan Wolfe, the co-founder and CEO of ZOE, a personalized nutrition company. In this episode, we talk about the gut microbiome, at-home test kits, and how ZOE helps people understand the impact different foods have on their well-being. We also discuss the benefits and challenges of a direct-to-consumer model versus seeking FDA approval for companies in the health diagnostic and wearable space. A quick reminder before we get into today's show. Every Tuesday, we send a weekly newsletter filled with insights and analysis on the business of fitness and wellness. Join other decision makers and industry operators by subscribing at insider.fit.co. Let's get into it. Hi, Jonathan. Welcome to Fit Insider. Thanks for joining us.
It's a pleasure to be here.
Looking forward to today's conversation. I think that you can provide a lot of, valuable insights and certainly an outlook on this personalized nutrition category and so many of the things that are happening. But maybe to kick things off, can you just introduce yourself and tell us a little bit about ZOE?
Absolutely, I'd love to. So I'm Jonathan Wolfe. I'm the co-founder and CEO of ZOE. And ZOE, as you said, is a personalized nutrition company. We run the world's largest nutrition science study, and we use this to power our product, which lets people understand how to eat to improve their health and weight. And just to unpack that a little bit more, it turns out what we eat is much more important than how many calories we eat. When we eat, it sets off a whole chain of responses in our body, and each of us responds differently to the same food. And so when you use ZOE, you start with an at-home test, and we then use artificial intelligence to compare you with thousands of people in our clinical studies. And we can then build a fully personalized program that understands how individual foods affect your health, your weight, even your energy. We launched at the beginning of this year, and we're having some pretty amazing results in our initial clinical studies. And I look forward to talking a bit more about that today, Joe.
Yeah, absolutely. And I think, there's so many things when people think about nutrition. There's, are we even if you're trying to make the right choices, are they the right choices for you? And certainly the idea of not just calories, but the quality of those calories, the types of foods that you're eating. From the user perspective, say I sign up and I become a customer, what does that kind of journey look like for me, and what do I encounter along the way?
Absolutely. So the journey starts by signing up and doing an at-home test. And so what that means is you go to the website, you get a box in the mail, and that box allows you to do a couple of things. Firstly, to do a series of tests, and we measure your gut health, which means you need to give us a sample of your stool. We also measure your blood sugar and your blood fat responses, which means we give you these scientific muffins, as they're called, and we do a finger prick to get the blood. And then we have an app that supports you that allows you to log your food for a few days so we can understand your standardized diet. So there's this very sort of intense starting point, which gives us this very, very rich information, which we can then use to compare with the thousands of people who were in our clinical studies and who had a much, much deeper set of information. That then gets sent off to our labs. We do the analysis, and a few weeks later, you then get the results. That's all obviously delivered to you digitally, and it gives you two things. Firstly, a readout, so you actually understand how your own body responds to food and how that is actually going to be different from every single other person that we do these tests with. And then most importantly, we launch you into our program. And the program is designed to actually take you on a journey to understand, how do I change the way that I eat so that I can achieve my goals? And those goals are generally a combination of specific health goals and, for many people, also weight goals.
Yeah, absolutely. And just on the product itself, is this I'm buying the one-time test kit and there's an accompanying app? Is there a subscription? How does the business model kind of work out?
Yeah, absolutely. And so the answer is there are two components to this. So this is definitely a subscription-based business, but you need to pay for a test in order to get access to that subscription. So you have a one-time fee, which really covers the kit, and then an ongoing payment that is covering the subscription. And that subscription gives you access to an app that supports this program, and also gives you access to our coaches who actually help to support you through, what is very complex. One of the interesting things about food is just how complicated it is compared to, for example, sleep, which is also incredibly important for your health. But, the advice is sort of pretty straightforward for most of us, which we need to sleep more. The question about how do you do it, but that sort of pales in comparison to this challenge of, a million different foods that we need to try and understand, and where we all have such different tastes for what we like to eat.
Yeah, I think, And maybe digging into that point a little bit more around the food, a lot of it centers around the idea of the gut microbiome and just gut health broadly. And that's nutrition, and there's different studies coming out, like it affects mental health, it affects chronic diseases, athletic performance, overall well-being, right? So many different things that we're just starting to pull that thread and understand. But it seems like there's a lot of unanswered questions, right? We don't know what we don't know. So it's a little bit of a black box. At a high level, like what are we even looking at or thinking about when it comes to the gut microbiome, and how is ZOE tapping into that? Like you said, given the thousands and tens of thousands, millions of different foods and combinations and individuals that all factor into that.
So it's a brilliant question, Joe. And maybe let me answer that actually by explaining a little bit the journey of how ZOE happened, because I think that might really help. Because, my background, my company prior to ZOE was a company called Criteo, which was using machine learning in order to create individually personalized ads. And in fact, if you've ever been like annoyingly stalked across the internet by a pair of shoes, then, I bear a lot of responsibility for that. What most people don't realize is the enormous amount of sort of computational power that goes into this. And so in the 7 years that I was there, we took Criteo from complete startup to 2,000 people and $2 billion of revenue. We went public on NASDAQ. And the heart of that was always this machine learning. We were sort of 500 engineers by the end, trying to understand how to personalize this. And why do I explain all of that? Because, what I saw at Criteo was this amazing power of machine learning if you can get enough data to do things that just weren't possible before. But we were using this to do something which at the end of the day didn't seem that important. We were helping people to sell slightly more shoes. There was nothing wrong with it, but I didn't really think it wasn't enough for me. So I left, and I was just really excited by this idea of how could we use this machine learning for something else that really mattered. And I ended up meeting one of my two co-founders, Professor Tim Spector, who is a very, very credible scientist. He's one of the top 100 most cited scientists in the world. He's been doing these amazing studies on twins, and he's one of the world's leader on microbiome science, as you said. And what he'd figured out was that everybody was responding differently to the same food. Even identical twins, when you gave them the same food, he actually saw these differences in what happened in their blood sugar and their blood fat, in the hours after you eat. And this really helped to explain what was one of the big mysteries in twins, which is how is it possible that you can have two twins and one of them ends up fat and the other ends up thin? One of them gets breast cancer and the other doesn't. Well, because they have the same genetics, right? We all know that. And they have the same upbringing. They grew up in exactly the same place for 20 years. So there's sort of this mystery about how that's possible. And Tim, dug into this mystery more and more and came up with the answer, Joe, that I think you were just talking about, which is they have completely different gut microbiomes. So these microbes that are inside your gut, and it turns out, there are as many microbes in our gut as cells in our body, have this profound impact on the way that we metabolize food and affects, almost every aspect from, not just obviously our metabolism, but we now see links to the brain and energy and all the rest of it. The challenge was, he could tell you, Joe, that you would respond to food differently from me, but he couldn't tell you what you should eat, right? So it's like sort of this brilliant science, but sort of useless.
Yeah, absolutely. I think even around that, we see that so much, not just as it relates to, personalized nutrition, which is in this very early stage and still understanding it and understanding the applications of it, but all health diagnostics, when you think about the kind of direct-to-consumer at-home testing, now we're seeing this kind of rise of continuous glucose monitoring, even for people who don't have diabetes.
That's right.
You're seeing different health wearables, fitness trackers, sleep trackers, as you mentioned, sleep. But it's like we have this data, and the idea is that with more data, we can make more informed decisions. What you don't measure, you can't change, all that kind of thought process. But it's still, how do we, one, implement this? And two, for the vast majority of people, especially, in the United States, the various health crises around obesity, chronic illnesses, heart disease, diabetes, we're not taking the fundamental foundational steps towards good health. So how do you think about that idea of like, all of this information is great, we need to personalize it and make them the right choices for individuals, but how do we hold that thought in our head with like, hey, we just need people to do something down the path of being healthy? Are these two things connected, or are they maybe like different steps on the same journey?
So I think these things are connected. And I think everything you said is exactly right, which is, I think there's this transformation going on now, which is for the first time, you can start to collect data at home, which is really useful for clinical decisions. And until very recently, the only thing you could do is do these studies in hospital if you wanted to understand what was going on with somebody's blood sugar, or if you wanted to understand, what was going on inside their gut. And so for the first time, we're starting to have these devices that allow us to measure data. And of course, your mobile phone is like the most powerful thing of all that allows you to input all this information. However, you've then got to be able to do something with it. And I think the challenge for this whole space is that you may have a lot of data, but you need to turn that into insight. And the heart of ZOE was this realization that when we launched the company, we weren't just going to go and launch a product. Actually, we went away, and for 4 years, all we did was what turned out to be the largest nutritional study in the world, in order to collect that raw data to then feed into these machine learning algorithms in order to actually create useful advice. Because at the end of the day, right, you, Joe, everybody wants to actually know, well, what do I need to do that's different? There's a very small number of people who want to look at all the raw data, for fun. Most people want to understand, like, what do I need to do to change, make easy and accessible changes in my life that are really going to impact my weight, that are really going to impact my health. And I think what's exciting is that out of all of this data, and the microbiome is a very important part of that, we've been able to build these algorithms and then build this platform that actually gives advice that work. And we can, now or later talk a little bit about our, the clinical studies that are coming out. But I do think that this point about how do you combine all that data to give results is key. And I think the other thing to realize is we're actually on a journey. So although, I'm incredibly excited by what we can do today, I also know that as we're continuing, everybody who's joining ZOE as a member has the opportunity to participate in our scientific studies. Almost all of them do. And they're therefore contributing more data that allows them and everybody else to understand better how they respond to food, because we are on a journey. And if you just take the microbiome as an example, we understand parts of it, but there is still so much to be unlocked in an organ that, 20 years ago, nobody even realized existed.
Absolutely. I definitely want to circle back to that, some of the clinical studies and what's happening on that front. But just down this path of, we mentioned putting those insights and data to use, and you have the app that accompanies the test kit. And more recently, we've seen this, the pairing of this digital tool and remote kind of coaching with the phone and the various digital health fitness apps. And in some cases, it's purely machine learning, AI, different types of chatbots. But there's also this, now we're using, obviously the kind of more medical healthcare example is telehealth, right? You're connecting with a doctor and doing virtual visits. But we're kind of seeing that in fitness and nutrition and health. Is the ZOE app combining like an actual person who is that coach, or is this all purely kind of digital machine learning tech?
So the answer is we're combining both. And possibly because I've really been in sort of AI and machine learning for the last 10 years, I think it makes me more humble than perhaps people who are less deep into it. Like, there's an awful lot of things that people are much better than machines at. And I think you need to understand what those differences are. So I think the machine could do this amazing job of taking this core data from the tests and comparing it with thousands of people and understand for a particular food, what does that all mean? But actually, if you want to help somebody to understand, like, I'm struggling with this, how do you help me over this hurdle? Or how do I really apply this in my life? There's a lot of things that a real person can do much better than a machine. And so I think, part of our learning over the last year is how important the support side is, that it's not just about having the right advice. You've actually got to help people to live that.
Yeah, I think that's been really interesting to see. And that kind of, some folks call it the human in the loop business model, or this kind of like behavioral coaching with someone. But certainly, like you said, there's some things that machines can't do, maybe can never do. So that human element is important. And then thinking about, a lot of times we have the various, I think of them as health optimization, wearables, tests, again, glucose monitoring. It's intended to impact these, kind of huge shifts in chronic illnesses, the needs that we see, like a metabolic health crisis or an obesity epidemic. But often,
Absolutely.
It oftentimes starts with, the biohackers or quantified self, the folks that are really into, tweaking the data, as you mentioned, like digging into it and toying with and tinkering with their habits. Do you have a sense for who are the core customers right now at ZOE? Like, are they different from who you're targeting and eventually want to get to? And maybe how are you acquiring them at this point?
It's a great question. And I think if you'd asked me this 18 months ago before we'd launched the product, I would have said, oh, Joe, I think you're right. We're going to see this really big uptake by people on the two coasts and really highly over-index on, sort of the biohackers you're describing. The good news is that's not been the case. And actually, if you look at our customers are people who actually really have a problem, really want this product because it matters to them. And as a result, they're coming back to us and saying, which is I've never had in any business I've been involved in before, like ZOE is changing my life. And so what that means is they're spread all across America. A lot of them are in Middle America. Obviously, they're also on the coast. They are all age ranges. We have these amazing customers in their 70s, as well as customers in their 20s. And in most cases, they really have an issue they want to deal with. So maybe they've been struggling with trying to lose weight for years, and everybody's been telling them it's all their fault. And finally, they've realized actually with ZOE, you know what? Everything I was being told about what was the right way to eat was totally wrong. And I was thinking about managing my calories, and I was eating all this food. And actually, they were eating this food that was so bad for them, was causing all this inflammation that was completely mismatched. And by shifting to ZOE, suddenly that's transformed. Similarly, we see a lot of people with real health concerns, and that can range from really a focus on healthy aging, which I think all of us, as you get older and you start to have kids and all the rest of it, we think about how do we make sure we're in great shape, or people with more specific concerns. And you talked about, people being concerned about metabolic diseases like diabetes or heart disease or all the rest of it. So actually, I think we've seen people with a lot more real issues. And I think that's incredibly exciting because what we've also seen is real impact on those issues.
I think it's such an interesting point that oftentimes, I talk to a lot of the founders of various digital health companies or nutrition startups. And it starts with, I had this problem that I went to every doctor and sought every medical expert that I could, and nobody could help me. And I was either, I'm going to give up or I'm going to start this company and solve it myself. And so I'm sure and it sounds like a lot of the customers you have are in this similar boat where they're like, I tried everything. I'm exhausted. Like, why is nothing working? Am I doing something wrong? They come across this solution and it starts to help them better understand and make the changes that are necessary, right? That nobody else was addressing. But on the other side of that, we still have kind of like, and maybe this is a good point to tie in some of those clinical studies, a lot of these products, kind of painting with a broad brush there, but are not maybe FDA approved. They're not medically or clinically validated. So they sit in like this wellness or well-being category. Is there, or maybe how do we move from this direct to consumer, just like well-being product to, this is clinically or medically backed, maybe even to the extent that the doctor is prescribing it or that insurance is paying for it?
I think it's a great question. And, in a sense, we jump straight to the business model today being direct to consumer. But actually, I think it's actually very surprising for ZOE that that's the case. I think if you think about the sort of science that is around it, Tim and, a set of scientists from Stanford and Harvard and Mass General Hospital, everybody been working on our PREDICT studies and the sort of results we're getting. So we've had a whole series of papers published in Nature Medicine over the last year. And, the way that the scientists have explained that to me is, being published in Nature Medicine for a scientist is really like being nominated for an Oscar if you're an actor, right? Most scientists never get a single paper in Nature Medicine. So the fact that we've had 2 just from our first clinical study sort of shows you the quality of the science. And normally when I speak to investors and people in this space, they're like, well, why aren't you going straight for a medical product, FDA regulated, and take it to market, as you said, through the health insurers and through the physicians? And the reason why is something we discussed a lot, both with Tim and my other co-founder, George, who, really drives the consumer product, is an amazing entrepreneur. And what we both felt was we didn't want to wait 10 years, basically, from the point when you've got some product that can really make a difference to being able to bring it to market. And actually, there is this opportunity now with wellness products using, particularly because ultimately this is around food, to actually be able to take that to customers and make a difference and learn about that. And ultimately, there's still the opportunity to deliver something that ends up being a regulated product that might be able to treat disease. Clearly, what we have is something which is a wellness product. It's not for treating diseases. We don't make any claims about that. But I think that's incredibly exciting. And I think this is the opportunity, I think, in the new world, in the same way that, the story of the last 18 months is a story about how, if there's a big enough pandemic, actually you can create a vaccine and go through all the proper clinical trials in less than a year. And you do that because of the way that you can use data today in a way you never could have done before. So I think that we are somewhere new. But if you want to do real science, you've still got to do the science properly. And so I think you've got to start with thinking about this in just the same way as you would do if this was a regulated product.
Yeah, it definitely makes sense. And actually, as you were talking about it, I was recalling a conversation I had on the podcast with the CEO of Noom, which is a basically behavior change, but focused around nutrition and weight loss habits. And I kind of asked him a similar question, and his response was, we tried to do that. We were basically, begging the various health insurers or FDA to help us go through this process, and they wouldn't. So we just said, look, we're going to go get tens of millions of users and just get to the point where they can't ignore us, and now they have to work with us, which I guess is maybe a little bit more, I don't want to say aggressive, but proactive approach. And I think similar to what you're saying is we can't afford to wait.
I think I wouldn't say that. So it's not, I think, our scientists are all, they're sort of world-renowned scientists who've produced amazing papers over decades. And I think they're very much, they're sort of part of the establishment in that case. So I don't think that it's to say that nobody will engage with us or that there's an aggressive take against that, just that there is this opportunity to go sort of directly to consumers, allow them to access this and actually just improve the product as you're going forward. And ultimately, I think, move into that regulated space, which I think is sort of inevitable for these digital, they will become digital therapeutics in the future.
Absolutely. And you even see, companies, big tech companies like Apple, who are now kind of backing into that space, getting more medical device, certainly setting up to go that path. So it makes sense that other digital options would go that way. And just,
I think it's inevitable, right? If you think about it, every other device in our life, like you think about our car is increasingly this digital machine, and you take it to the dealer once a year and it downloads the data, and they catch the problem before it happens, which is why our cars are so incredibly reliable. And the reality is that, as the most complicated device we have by 1,000 orders of magnitude is our own body. And, what doctors can do is take these very thin slices when they come in to see you with very, very limited data. And so clearly there is a future where the data that is actually being collected and the sort of things that ZOE is able to do can really be used to understand, health outcomes and to allow interventions, I think, that can really make a difference to our long-term health.
Yeah, it's kind of a perfect setup actually for a question that I had in mind and wanted to ask you was, when you think about that, and now it feels like things are happening quickly, but it's still very much early innings when it comes to these digital therapeutics and personalized options across all of health and well-being. I've mentioned a few of them now, wearables and glucose monitoring and at-home tests. And even when you go further down that path, like the primary care and health data and all the things that you can test and tweak and optimize, is it just going to be that we're going to have a different siloed, fragmented device, test, app for every different aspect of health? Or does this roll up into one offering? And how do you see kind of ZOE sitting in that evolving landscape?
So I think, even as you say the question, it sort of sounds absurd, right? You obviously can't have 10 different devices giving you these 10 different things like that. That doesn't make any sense, in the same way that when you go and see your doctor or you see your nutritionist, they take a whole set of data and then they need to give you this consolidated advice. So I think the core of ZOE is not any particular test. The core of ZOE is this combination of all this data, which we take from lots of different tests. And in these clinical studies, they were incredibly intense, what the participants went through to give us this view, not just blood sugar and blood fat and microbiome, but all of these different inflammatory markers, this incredible range of what they call metabolites, which are the thousands of different chemicals that are inside our body. The value is basically to integrate all of that together and be able to understand, based upon it, how do I give advice to somebody? And then if they follow that advice, does it actually make a change? And you asked a little bit earlier about sort of our results. So we just have interim clinical trial results at this point. But what we see is that 80% of people who are following our program have more energy after 3 months. We see that there's an average loss of 9 pounds of weight at 3 months. And what's really amazing is this is a program with no calorie restrictions whatsoever, with no focus on any sort of short-term weight loss or something that's focused specifically on energy. All of this is focused on how do you actually end up eating in a way that is right for your health, that is going to reduce your inflammation, that is going to boost those good microbes inside your gut and reduce those bad microbes. And so I think those results are really exciting and show that as you layer on more data, we can make these programs better and better. And so I think we're very excited by what we have today. But I think as we get more of this information, you can imagine that in 24 months' time, there can be significant improvements on the advice we can give and the way that we can personalize the advice that you get, Joe, versus the advice that I get.
Sure. And you kind of alluded to it there, thinking about how these studies continue to evolve, also how the product will continue to evolve. As we get towards the end of the conversation, probably makes sense looking ahead a little bit. The company has raised, some $50 million to date, with the most recent funding round coming in May. It's like $20 million. So certainly a lot of resources, right? Kind of thinking about how you put that to work. What does the roadmap look like? What are you excited about and looking forward to as you continue to chip away at this?
Yeah, absolutely. So I think there's two parts there. So the first bit is, for the first time, we're really commercializing the product. And up until we raised that money, we just went live at the beginning of this year. We're still very constrained operationally. Now we're starting to expand that. So that's very exciting and starting to be able to give that to a lot more people. And, I think for me and for George and Tim and everyone else, the feedback from individuals who tell us, this has been amazing. I've been struggling with something sometimes for decades, and it's just, changed my life. That is, I guess, the most exciting thing. And then the second thread, which I think you touched at, is this continued progress with the science. So we're continuing all of these scientific studies with these fantastic scientific partners that we have. And as everybody is joining these studies, we're getting more and more data. And we've seen some really amazing results this year. So we've done a study looking at the impact of nutrition on COVID. We had more than 1 million people who participated in that clinical study. And what we saw is that when you look at the differences between people eating the highest quality diet and the lowest quality diet, there was a 10% difference in people's likelihood to get COVID. But even more amazingly, there was actually a 40% lower chance of ending up being hospitalized with COVID if you're on that highest quality diet than on that lowest quality diet. And this is after adjusting for obesity and age and all sorts of other health factors. So I think this sort of points to what we can start to understand as we scale this up. And also I think just points to the incredible importance of food in really tackling the sort of chronic issues that you were talking about that are affecting us, across the States and of course across the rest of the world.
Yeah, I think that piece around continuing to drive the science and the studies and one, yes, of course, implementing that into the product, and then it makes its way into informing the process and journey for users, but also just putting a lot of that stuff out there to inform the broader, really anyone who can take in. You mentioned publishing in the journal Nature. I know there's a lot of really great resources on the website. We wrote a report on gut health and personalized nutrition for Fit Insider, and a lot of what we pulled from certainly the twin study and a lot of those things came from the website. So it's a great resource. And kind of to that, as we wrap up here, what's the best way for maybe people to learn more about ZOE, maybe start the journey and just check out the various products and offerings that you guys have put out there?
Absolutely. So I think the best next step is to go to the website. The website is joinzoe.com. So that's joinzoe.com. And you can take a look around. There's a lot of content that's available there, as you said, because it's very important to us to make that available. And if anybody does want to go ahead and try the product, which, of course, I recommend because it's certainly changed, dramatically for me, the way that I eat, then do go ahead. And if you want to use the code Jonathan, which is just my name, JONATHAN, then there's a $35 discount for anybody who's been generous enough to listen to the end of this podcast. And either way, I think it's really important to us to get this information out there. So I think we try really hard. We produce a lot of stuff that also ends up on YouTube and social media more broadly, as well as the sort of these papers, because as we understand this science, at this point, this is not a really cheap product, right? You can't do this for $5 yet. And we want to make this available to as many people as possible, at least with the broader learnings, so that we can have the biggest possible impact on people's health.
Yeah, absolutely. I encourage people to check out all those, the website, the various resources, as you said, the YouTube channel. And I'm just grateful that you made a few minutes today to share all the insights with our audience. I know it's certainly a topic of interest, so I appreciate you coming on to talk about it with me.
Joe, it was a real pleasure. Thank you so much. Look forward to talking again.
Thanks everyone for listening to today's episode. For more from Fit Insider, visit insider.fit.co and subscribe to our weekly newsletter for insights and analysis on the business of fitness and wellness. Then go ahead and subscribe, rate, and review the podcast. See you next time.